Which oral antidiabetic drug is recommended as first-line therapy for most overweight patients with type 2 diabetes mellitus? Speak. Metformin. Remember, met meets fat first. What is the primary mechanism of action of metformin? Inhibition of hepatic gluconeogenesis via AMP-activated protein kinase activation. Remember, MET stops glucofactory. Speak. Prosody rate 100%. Which potentially fatal metabolic complication is most closely associated with metformin therapy, especially in renal failure? Lactic acidosis. Remember, lactic lake with MET. Name the rapid-acting insulin analog with the fastest onset of action. Insulin Lispro. Remember, Lisp is quick. Which long-acting insulin provides a relatively flat 24-hour basal profile and is given once daily at bedtime? Insulin Glargine. Remember, Glar glides all day. Which class of oral antidiabetic drugs acts by closing pancreatic beta cell ATP-dependent potassium channels, thereby stimulating insulin release? Sulfonylureas. Remember, sulf shuts K gates. Identify a second-generation sulfonylurea with the highest risk of prolonged hypoglycemia in the elderly. Speak. Prosody rate 100%. Glyburide, glibenclamide, prosody. Remember, glyburide varies sugar. Which oral antidiabetic drug class is most likely to cause weight gain and fluid retention and was contraindicated in heart failure? Thiazoledinediones, pioglitazone. Remember, PIO PATS pounds. Thiazolidinediones exert their glucose-lowering effect primarily by activating which nuclear receptor? PPAR gamma, peroxisome proliferator activated receptor gamma. Remember, PPAR gamma glows. Which class of antidiabetic drugs delays carbohydrate absorption by inhibiting brush border alpha-glucosidase enzymes? Speak. Alpha-glucosidase inhibitors. Example, acarbose, miglitol, etc. Remember, ACAR blocks carbs. Speak. Which injectable incretin mimetic was the first GLP-1 receptor agonist approved for type 2 diabetes? Exenatide. Remember, EXE exits glucose. Name an oral DPP-4 inhibitor that can be used safely in moderate renal impairment without dose adjustment. Linagliptin. Remember, Lena loves kidneys. Which novel class of antidiabetic agents promotes glycosuria by blocking glucose reabsorption in the proximal renal tubule? Speak. Prosody rate NJLT2 inhibitors, e.g. empagliflozin. Remember, flozin flushes glue. What common genital adverse effect is associated with SGLT2 inhibitors due to increased urinary glucose? Mycotic fungal genital infections. Remember, sweet pea feeds yeast. Which antidiabetic drug is an amylin analog that can delay gastric emptying and reduce postprandial glucagon secretion? Pramlintide. Remember, cram slows plate. Which sulfonylurea is preferred in chronic kidney disease because it is metabolized to inactive compounds? Glipizide. Remember, GLIT sits in CKD. Name the short-acting insulin secretagogue class that is taken just before meals to control postprandial glucose spikes. Speak prosody rate 100%. Meglitinids, repaglinide, and niteclinide. Remember, Meg bites meal spikes. Which wiglutinide has the shortest half-life and thus the lowest risk of late post-meal hypoglycemia? Speak nataglinide. I speak from myself. Remember, Nate is nimble. Severe hypoglycemia due to insulin overdose is treated with IV dextrose, or which hormone that increases hepatic glycogenolysis? Glucagon. Remember, glucagon saves. Which long-acting basal insulin uses fatty acid acylation to bind albumin, extending its duration to extra 24 hours? Speak, prosody rate 100%, insulin detamir. Remember, deter anchors alb. Which insulin preparation is cloudy because it contains protamine and zinc, providing intermediate action? Speak, neutral protamine hagedorn, pro-speak. Remember, NPH needs PE soup. Lipid dystrophy at injection sites is minimized by what simple technique? Speak, prosody rate 100%. Rotating insulin injection sites. Remember, rotate, avoid dense. Which GLP-1 receptor agonist is approved for once-weekly administration due to its long half-life? Dulaglutide. Remember, doula, done weekly. Which antidiabetic drug class can reduce cardiovascular mortality in type 2 diabetes patients with established atherosclerotic cardiovascular disease? Speak, prosody rate 100%, SGLT2 inhibitors, particularly empagliflozin. Remember, flozin favors heart. Which DPP-4 inhibitor is most associated with a risk of heart failure hospitalization and thus used with caution? Speak 50%. Remember, Saxa strains heart. Which adverse effect of GLP-1 agonists often leads to dose titration to improve tolerance? Speak, prosody rate 100%, nausea and vomiting, prosody. Remember, GLP-1 makes gut churn. What is the principal concern when combining sulfonylureas with alcohol ingestion? Disulfiram-like reaction. Remember, sulf plus sip sours. Which sulfonylurea is safest in pregnancy because it has minimal placental transfer? Gliburide, glibenclamide. Remember, Glibery guards baby. What is the preferred treatment for diabetic ketoacidosis, DKA? Regular IV insulin with fluid and electrolyte replacement. Remember, Reg Insul rescues DKA. Which oral antidiabetic class can increase bone fracture risk, particularly in women? Thiazolidindiones. Remember, TZD weakens frame. Metformin is contraindicated at an estimated glomerular filtration rate, eGFR, below what value? ml liters per minute / 1.73 meters squared. 30 milliliters per minute / 1.73 meters squared. Remember, MET stops at 30. Which insulin peak effect can precipitate nocturnal hypoglycemia if given at night? Speak prosody rate 100%. NPH insulin peaks 4 to 10 hours. Speak. Remember, NPH peaks night. Which oral antidiabetic drug lowers both fasting and postprandial glucose without causing hypoglycemia and often produces weight loss? Speak. Metformin. Remember, MET melts fat safely. Which medication is a bile acid sequestrant approved as add-on therapy in type 2 diabetes? Calesevalam. Remember, coal soaks sugar. Which dopamine agonist can be used to lower early morning glucose in type 2 diabetes by resetting circadian rhythm? Bromocriptine. Remember, bromo boosts morning. Dawn phenomenon hyperglycemia is best managed by adjusting the timing or dose of which insulin type? Speak. Long-acting basal insulin, example, glargine. Remember, dawn needs basal boost. Which ultra-long-acting insulin, half-life 25 hours, allows flexible once-daily dosing without strict meal timing? Insulin degludec. Remember, deglu drifts days. Sulfonylureas are ineffective in which monogenic form of diabetes characterized by defective, ATP-sensitive K-channel? Speak. Neonatal diabetes due to KCNJ11 mutation. Remember, KMUT kills sulf. Which antidiabetic drug class may precipitate euglycemic ketoacidosis, especially during prolonged fasting or low-carb diet? SGLT2 inhibitors. Remember, Flozin, FODKA. What laboratory test must be monitored periodically when treating with pioglitazone because of potential hepatotoxicity? Liver function tests, ALT, AST. Remember, PO probes liver. Which oral antidiabetic drug has the fastest onset, less than 15 minutes, and is suitable for managing post-meal spikes when taken immediately before eating? Repaglinide. Remember, Rapid Repist. Which GLP-1 agonist has FDA approval for chronic weight management at higher doses than for diabetes? Speak. The Raglitide. Remember, Lira lightens load. Which oral antidiabetic drug is a contraindication with contrast media due to risk of renal impairment and lactic acidosis? Speak. Prosody rate 100%. Metformin. Speak. Remember, stot met before die. Which class of drugs should be avoided with sulfonylureas because they displace them from protein binding, increasing hypoglycemia risk? Salicylates, high-dose aspirin, and sulfonamides. Remember, salicyle stings sulf. Name the endogenous hormone whose deficient post-meal rise is mimicked by pramlintide therapy. Amylin. Remember, Amy Meal Minder. Which sulfonylurea is preferred for patients with sulfa allergy substitution because it lacks sulfonamide moiety? There is no sulfonylurea safe in sulfa allergy. Use non-SU agents, e.g. megliteinide. Remember, no sulf for sulfa. Which peptide hormone deficient in type 1 diabetes suppresses glucagon and slows gastric emptying, thus targeted by synthetic analog pramlintide? Amylin. Remember, Amy quiets gluc. Give one advantage of insulin analogs, Lispro aspart, over regular insulin for mealtime coverage. Lower postprandial hypoglycemia due to faster absorption and shorter duration. Remember, analog avoid delay dip. Which drug combination is specifically contraindicated because both agents increase risk of bladder cancer? Pioglitazone with dapagliflozin. Remember, PIO plus DAPA bad. Which oral antidiabetic agent improves insulin sensitivity in muscle and adipose tissue but may worsen osteoporosis? Pioglitazone, a thiazolidinedione. Remember, PIO pores porous bones. What is the mechanism of action of sitagliptin in lowering blood glucose? Inhibition of DPP-4 enzyme, prolonging endogenous GLP-1 and GIP activity. Remember, sita saves incretin. Which insulin regimen mimics physiologic basal bolus secretion using multiple daily injections? Speak, prosody rate 100%, long-acting basal insulin once daily plus rapid-acting insulin before meals. Speak. Remember, basal plus bolus ballet. Which drug class targeting PPAR gamma can improve lipid profile by increasing HDL cholesterol? Thiazolidinediones. Remember, TZD tweaks trigs. Which insulin adverse effect can be mitigated by adding potassium to IV fluids during DKA treatment? Hypokalemia due to insulin-driven intracellular K+ shift. Remember, insul pulls K in. Which GLP-1 agonist showed significant reduction in major adverse cardiovascular events, MACE, in LEADER trial? Liraglutide. Remember, lira leads heart. Which effect differentiates exenatide from liraglutide regarding dosing frequency? Exenatide is twice daily or weekly ER. Liraglutide is once daily. Remember, EXE2 lira times 1. What is the primary reason sulfonylureas often fail after several years? Secondary failure. Prosody rate 100%, progressive beta cell decline and exhaustion. Remember, beta burns out. Which oral drug class for diabetes can lower systolic blood pressure by osmotic diuresis, in addition to lowering glucose? Speak, CLT2 inhibitors. Remember, flozin flushes pressure. Which anti-hyperglycemic drug is contraindicated in patients with medullary thyroid carcinoma history? GLP-1 receptor agonists, particularly liraglutide semaglutide in rodents, caution in humans. Remember, GLP-1 guards thyroid. Which alpha-glucosidase inhibitor has additional benefit in reducing postprandial triglycerides in some studies? Speak, prosody rate, 100%. Miglitol. Remember, migl mutes mouth fat. Which sulfonylurea can cause a flushing reaction with alcohol similar to disulfiram? Chloropropamide. Remember, chlor cheers flash. Which insulin preparation is used in insulin pumps for continuous subcutaneous infusion? Speak. Rapid-acting analogs, insulin lispro or aspart. Speak. Remember, pump likes lisp. Which drug class for type 2 diabetes can induce pancreatitis, necessitating patient education about abdominal pain? GLP-1 receptor agonists and DPP-4 inhibitors. Rare. Remember, incretin inflames pancreas. What is the recommended first step when a patient on metformin and lifestyle therapy has HbA1c greater than 9%? Initiate combination injectable therapy, basal insulin plus minus GLP-1 agonist. Remember, over 9, add needle. Which antidiabetic agent works by reducing hepatic glucose output and improves insulin sensitivity without directly acting on pancreas? Metformin. Remember, met tames liver. Speak. Which anti-obesity drug, a GLP-1 agonist at high dose, can also treat type 2 diabetes at lower dose? Semaglutide, higher dose Wegovy for obesity, lower Ozempic for diabetes. Remember, SEMA slims sugar. Which sulfonylurea acts the longest and is therefore dosed once daily, but poses higher hypoglycemia risk? Glimepiride. Remember, glim glides long. Which oral antidiabetic drug can raise LDL cholesterol slightly but lowers triglycerides when combined with statins? Pioglitazone. Remember, PIO lifts LDL a bit. What is the main adverse effect monitoring parameter for SGLT2 inhibitors related to renal function? eGFR and serum creatinine. Avoid if eGFR is less than 45 milliliters per minute. Remember, Flozin needs filters. Which insulin analog dimerizes less in solution, leading to faster absorption from subcutaneous tissue? Insulin lispro. Remember, lispro, little dimers. Which short-acting insulin can be administered intravenously in hyperkalemia due to its rapid onset? Speak. Regular insulin, soluble insulin. Prosody rate 100%. Remember, reg rescues K+. Which antidiabetic drug class has a black box warning for necrotizing fasciitis of the perineum, Fournier gangrene? Speak. Prosody rate 100%. SGLT2 inhibitors. Remember, flossen fear flesh. Hypersensitivity to which component causes allergic reactions to protamine-containing insulin, NPH? Protamine. Remember, protamine prickles skin. Which insulin regimen is most physiological for type 1 diabetes in children with unpredictable meal patterns? Speak. Continuous subcutaneous insulin infusion, with rapid-acting insulin. Remember, pump suits play. Which hormone opposes insulin and is elevated during severe hypoglycemia, explaining adrenergic symptoms? Epinephrine. Remember, epi elevates energy. Which insulin analog causes least nocturnal hypoglycemia compared with NPH when used as basal insulin? Speak. Prosody rate 100%, insulin glargine or deglutic. Remember, Glarnite Guard. Which class of oral antidiabetic agents requires dose reduction when given with rifampicin due to CYP450 induction? Sulfonylureas. Remember, Rifa Rod Sulf. Which incretin-based therapy is available as an oral peptide after novel absorption technology with SNAC, sodium N/8-2-hydroxybenzoyl amino capryllate? Oral semaglutide. Remember, SEMA swallowed smart. Which insulin injection site, abdomen versus thigh, has fastest absorption, useful for pre-meal dosing? Abdomen. Remember, belly beats butt. Which oral antidiabetic drug can cause vitamin B12 malabsorption on long-term use? Metformin. Remember, Met masks B12. Which SGLT2 inhibitor showed renal protective effects in the Credence trial for diabetic nephropathy? Canagliflozin. Remember, Cana cares kidney. Which insulin-related condition describes post-hypoglycemic rebound hyperglycemia due to counter-regulatory hormones? Somogyi effect. Somogyi effect. Remember, SOMO swings sugar. Insulin allergy is most often due to which immunoglobulin class? IgE. Remember, IgE itches insul. Which unique adverse effect of pioglitazone warrants periodic ophthalmologic evaluation? Macular edema. Remember, PIO puffs macula. Which glucose transporter is inhibited by SGLT2 inhibitors in the renal proximal tubule? Speak. Prosody rate 100%, sodium glucose cotransporter 2, SGLT2. Remember, block SGLT2. Which hormone level rises with DPP4 inhibition besides GLP-1, contributing to insulinotropic effect? Speak. Glucose-dependent insulinotropic polypeptide, from prosody rate 100. Speak. Prosody rate 100%. Remember, break time 100. GIP grows glue glow, prosody. Which adverse effect common to GLP-1 agonists can also delay absorption of orally administered drugs? Speak. Delayed gastric emptying. Speak. Remember, GLP-1 slows stomach. What is the rule of 500 used for in multiple daily insulin regimens? Estimating carbohydrate coverage ratio, 500 divided by total daily insulin dose, equals grams of carbs covered by 1 unit of rapid insulin. Remember, 500 carb code. Which antibody screening helps predict autoimmune beta cell destruction in type 1 diabetes? Speak anti-GAD glutamic acid decarboxylase antibodies. T. Remember, GAD guards gone beta. Which non-sulfonylurea insulin secretagogue is preferred in patients with sulfur allergy? Remember, MEG minus sulfur. Which oral antidiabetic agent can modestly lower A1C but is mostly used for postprandial hyperglycemia when taken with the first bite of food? Acarbose. Remember, ACAR after appetizer. Which GLP-1 receptor agonist is given as weekly subcutaneous injection and has demonstrated weight loss greater 10 kilograms in trials? Semaglutide once-weekly form. Remember, SEMA shed size. Which insulin storage condition maintains potency, refrigerated 2 to 8 degrees Celsius, frozen, or room temperature up to 28 days after opening? Refrigerated 2 to 8 degrees Celsius, opened vials stable at room temperature for up to 28 days, not frozen. Remember, cold, not ice. Insulin resistance is often assessed clinically using what triad of features in metabolic syndrome? Central obesity, hypertension, dyslipidemia. Remember, big belt bad BP. Which cytokine-reducing effect of pioglitazone contributes to improved insulin sensitivity? Speak, prosody rate 100, reduction of TNF-alpha and increase in adiponectin, prosody, and speak. Remember, PIO pumps adipo. Rule of 15 in hypoglycemia management refers to what? Give 15 grams fast-acting carbs, recheck glucose in 15 min. Remember, 15 fixes fall. Which GLP-1 agonist is available in a once-monthly formulation under investigation? Icosema, combination insulin icodec plus semaglutide, in trials. Remember, ICO monthly magic. Which oral antidiabetic drug may precipitate cholestatic jaundice, especially in elderly patients? Chlorpropamide. Remember, chlor chills liver. Which combination therapy offers complementary mechanisms? Metformin, hepatic, plus SGLT2 inhibitor, renal, plus GLP-1 agonist, gut. Triple therapy for type 2 diabetes improving A1C, weight, and cardiovascular risk. Remember, liver, kidney, gut trio. Which common over-the-counter drug can mask adrenergic warning signs of hypoglycemia in insulin-treated diabetics? Non-selective beta blockers, example, propranolol. Remember, BIHA blind low,